I was going to ask you, where's my espresso martini? Isn't it small town grit with espresso martinis? I mean, it's morning.
A little drink, a little mimosas.
Yeah. Oh, that would be great. I love
have not
mimosas.
had a morning drink, and I couldn't tell you when.
Yeah, that's a vacation thing.
We're here on another episode, Getting Gritty with Dr. Jean Barden. And are you ready?
Sure.
To get gritty?
Sure.
So, Jean, you got a little practice here in town in Vassar, but you actually had 2 practices at one time not too long ago.
I did.
Was it hard having 2 practices?
Yes, it was never really what I had intended. I think, throughout my career, I thought that a partnership, single location would have been my kind of thing. Life doesn't always work out that way, and I was offered the opportunity to purchase 2 practices at the same time. And so, because they were both very small practices, it made sense that I would just go back and forth between the 2. But, it was logistically not ideal for me. Mm-hmm. And I think some people really just want to grow and grow. And other people, are more like for me, I wanted to simplify life, even if that meant that, I wasn't going to make as much or bring in as much. And then fortunately it worked out. It's just been much better. So a lot of my patients from Marlette have followed me over to Vassar. We are now busy 3.5 to 4 days a week seeing patients, all nice, beautiful, renovated location, thanks to Gory.
Yeah, for those that we should have jumped into, what kind of doctor are you? I mean, what do you do day in and day out?
Eye doctor, optometrist. So I do everything from routine exams, from children up to 90-some-year-old patients, to treating eye infections, removing metal out of people's eyes on a very regular basis. I think I'm getting known around the area they need to come to me, which is great because I love it, and I would much rather them come to me because I think I can do a much better job than if they try to go to the emergency room.
That's one thing that Brian came on board this last year. He's been here with us for a year, and it was like the safety procedures that he brought upon us. I was like, I never thought of it. We just did it. And we just get out of habit. We don't throw safety glasses on or hearing protection. And
yes.
And I think we need to do that, especially as you get older.
Absolutely.
But even when you're young, I mean, that's when it's worse exposure when you're young and you're having...
Right, with the hearing and everything, but
you and I talked about it one time. Is like, how do you know like when an infant can't see or has seeing issues?
I mean, it really is difficult. I think sometimes there's a family history of strong prescriptions or eye turns. You might notice something like that and bring a child in, but really we just recommend that all kids get eye exams. In fact, we are part of a American Optometric Association program called Infancy. So we will do a free eye exam for infants up to 1 year of age. And people don't really understand, what are you really able to detect? Well, we use dilation drops in the children's eyes so that we can relax their focusing, see if there's any big prescriptions. We're not refining it to a very, but big prescriptions, and we're looking for any eye health issues.
Yeah, because I remember there's like a video circulating on there, like a little 1-year-old, and she gets these little pink glasses on and sees her mom for the first time. She's heard her for the whole year, but has never seen her in clear vision. And it was like, you kind of want to tear up and be like, I couldn't imagine. Or even somebody going blind, or, Steve that works for us, he's colorblind. I know that's pretty common trait for males, more than women, right? And I couldn't imagine not seeing every day in color. Right.
But most people who are color deficient, so they're not seeing black and white.
Okay.
So
that's what I always saw. It's like black and white. I'm like,
no. People who really are black and white, they have very reduced vision. So it's a different thing. But color deficiency, I mean, people don't really even think they don't see things normally. I mean, Adam is color deficient, and he would argue with me about colors. I'm like, so for most people, it doesn't create a big issue. It's more of a issue, I think, with certain careers. for electricians who need to be able to see the difference between wires.
Steve's background in sales, and we were at a point where we're going to maybe position him in a different situation. And like, I really like the background of him to sell, but you know, in our business, everything's color oriented. So I'm like, it really wasn't a good fit for that profession. And I'm like, but he runs our lawn maintenance right now. And I'm thinking of like, if you can't see colors or shades properly, just even, let's say, weed whip some grass. I'm like,
yeah, I don't know. I think a lot of times there's visual cues that kind of help, you know. So even though he may not see the colors truly the way that you would see the colors, you know, usually there's still differences.
Yeah, I'm sure everybody adapts. It's just, you know, I grew up with classmate. He only had one eye, is blind in one eye from sledding, and got a stick poked in the eye. And we have a common acquaintance in town, a contractor that has one eye, and it's amazing what they can do with one eye.
Oh yeah,
you know.
Right. We depend on that depth perception. If we didn't have it, we would notice a difference. But something like that, that's long term, people adapt to.
Yeah, we talked the other day. It's like, if you get jabbed in the eye, is it full of liquid in there? Will it all drain out? Is it? It
will slowly.
Like, what happens, right?
Yeah, it will seep out, and luckily I haven't had any of those. Knock on wood. The way things have been going, if I say something, I manifest it. So we look for that when we have any type of, you know, penetrating trauma, because that can be very serious, more from the standpoint of the introduction of any bacteria inside the eyeball is very, very serious.
Okay. Yeah. So, I mean, sometimes you get slivers or people come in with metal objects in their eye. At what point, I don't know, I'd just be like cautious. Be like, if I pull this out, like, what else is going to come out?
I mean, they're usually very superficial, embedded in the cornea. So you remove them with a little bit of a metal spud, and numb the eye up really well, of course. And then I have this little tool that's like a little brush. It's called an algae brush. Yeah. And it has a little battery in it, and it spins, makes this buzzing sound. So I always kind of forewarn people. I'm like, this is going to sound bad because it makes this buzzing sound, but it digs out usually the remnants of the metal. And usually rust is the main thing that's left over, because people don't want to come and see me right away when this happens. For some reason, they like to wait a couple of days until the eye is really inflamed and angry, and so then we get a lot of rust in there that we have to dig out. It's like a sliver.
You just let that thing just pus up, and then the eye waters enough, you think it's just going to flush itself out.
So the advantage of, like, when I remove a foreign body versus if you were to go to the ER. In fact, I do get some ER referrals from Marlette still for that kind of stuff. But I have a microscope that I can use so I can see very fine detail. And then I put a bandage contact lens on the eye, and it makes people feel very, very good. So it's one of the most satisfying things that I do.
Nice.
My kids are always like joking, like, "Did you have a good day, Mom? Did you get any foreign body removals today?" Like, so.
Yeah. So you went to the Ferris State.
Yeah, I did my undergrad at Ferris. And then because I knew when I went to college that I wanted to be an optometrist, so they have the only optometry school in Michigan still. I did undergrad, got into the optometry school, and it's actually called Michigan College of Optometry now. But then I did the next 4 years. Well, I did 3 years on site, and the last year was completely clinical.
Yeah, Ferris State has changed a lot. You guys go back and visit at all, or is it?
I've been back a couple of times since, and it changed tremendously. So kind of going downhill a little bit. There was some embezzlement by a president and some things that went on before I went, and but I think, if you see how it is now, and they have a lot of special programs at Ferris. I'm a huge Ferris proponent because a lot of special things like plastics program, surveying, pharmacy, optometry. I think they do a great job.
So it wasn't until college that you knew that your calling was optometry?
My junior or senior of high school. Dr. Hilligan, he used to practice in Vassar. He did a career day at the school. So I was kind of debating between medical school and, other medical professions, and optometry seemed like a good fit.
Are you a Taylor Swift fan?
Elise made me go to the
I remember.
concert movie
Oh.
You know, it's a movie that you go to, but it's actually the concert, right? Okay, so.
Is it Taylor Swift though?
Yeah.
Oh, okay.
Yeah. So I went to that, and I did have a greater appreciation for Taylor Swift after that because her show is really phenomenal. I think it would be.
Are you questioning her $1 billion net worth or?
No, but I mean, it's not, it's okay. Like, it's not, I mean, I think she's very good.
Yeah.
But like Elise, literally is the only thing she will listen to. Oh, Olivia Rodrigo and Taylor Swift.
Okay.
She shows no other appreciation for other music.
That is not my jam. I never was a Taylor Swift fan, even when she came out. I just nothing against her. It just wasn't my.
Yeah,
my
exactly.
lane.
That's
So,
but we drugged the kids to a concert last summer, 3 doors down during the Cherry Festival in Traverse City, and it was so good, and we had such a good time. And so this summer we're going to be camping up in Traverse City area again. And we found tickets to the Goo Goo Dolls.
Oh, wow. That's exciting.
So we're
and that's all outdoors, isn't it?
Yeah.
It's like an outdoor amphitheater. So your husband also has a business in town.
Yes.
So you guys have very busy lives and dynamics. And how does that work out with family life? I mean, that's got to be a struggle. I mean, I know it's been a struggle for me the last almost 20 years.
Yeah. Pros and cons. So I asked the kids like yesterday, I'm like, what do you guys, what do you think of your parents both owning businesses and how it affects their lives? And I mean, really, they hardly know any different. They don't remember from prior to that. So I don't know that they have any really good comprehension of what the difference would be really. But Elise, said flexibility. So the flexibility came into like, well, when we were sick or something, dad could stay home.
Nice.
Because and sometimes it was grandma's because grandparents are close too, which is the advantage of coming back. But I'm a little bit less flexible on the days that I work because I don't want to cancel 20
you have set
patients.
appointments.
Yeah, exactly. So I don't cancel my schedule very easily because it has to be really something significant. But so the flexibility is good. Adam's able to go to things, during the week, or I can usually adjust my schedule if I have enough notice and want to get to like a track meet or something like that.
Yeah, I think it was a little bit easier when the kids were young, but now, I mean, your kids are all older now.
Right.
They're in all kinds of activities, whether it's play or karate or track or piano. It seems like they're in everything. But you have a daughter that's going to be driving pretty soon, right?
Right, that's going to help a lot.
Yeah, is that scary?
I mean, sometimes when I'm driving with her, it can be a little bit scary to think she's going to be on her own. But I think we're just so looking forward to it because we make so many trips back and forth to school. So the parking is, we need to do some parking so she can pass her tests. That's the big thing. She's going to kill me when she hears this.
So Lisa's never ridden with either one of the boys. She will not, to this day, yeah. I mean, it's been over a decade that Jordan's been driving, and she has not.
He races cars.
Right, yeah, but she will not do it. I don't know what it is. So I had to do everything. Yeah, it was like, all right,
yeah, I think Reed's going to be a little bit more difficult. Him and I don't do well together.
I almost got in an accident in driver's training. Ooh. I got cut off, and then we almost got in this T-bone accident. And then I don't know if they still have it, but they got like the emergency brake on the teacher or whatever on the passenger side.
Do they still have that?
I don't know. Well, he hit the brake, and we're like, but whatever, it was fine.
Gosh.
But it was crazy.
Well, I'm just glad that they do the driver's training the way they do now because I should have never gotten my license.
We just got them.
Oh, yeah.
Oh, you're done. Here you go.
Yeah, I had driver's training in June, and I got my license in July.
Yep.
And I was not very good, and I didn't have to take a driver's test or anything to prove I could actually. Yeah, it wasn't good.
Yeah,
wasn't good.
Now you have to log like a year of hours.
Yeah, 50 hours. So yeah, but anyway, I mean, back to the original question. I think, it's like today. Adam wasn't supposed to be off in the morning. We were going to go for a run before I had to do this, and he got a call. Somebody called in, and he had to go in. So there's that too.
Yeah.
The kids are used to that. Things sometimes don't work out quite the way we want because the business is sometimes has to come first.
So with running, I know your daughter's a pretty avid runner. I don't know by choice, but
Oh yeah, no, she actually loves it. I mean, it's ingrained in her probably from when she was young.
Yeah.
But yeah, she doesn't like always competing, but she really does love running.
So you guys competed in a half marathon in Detroit?
We've
Or
done
full-
two halves.
Just halves, yeah.
Just halves.
Yeah.
Yeah. No, we did 2 Detroit, and then I've done 3 other. Well, one was a 20K, but that's about the same.
Yeah.
It's almost the same thing.
Yeah. Was one in Traverse City? Was that-
Yep, I did one.
Yeah, 'cause
Yeah, I
we
did Bayshore.
We camped that time.
Yeah,
and,
yeah.
And then you did a run. Mm-hmm. I mean, I remember you guys months up. You guys had a pretty detailed schedule on
Yes.
how to prepare for that, and I mean, it was 7-mile run. I mean,
Yeah.
I couldn't imagine, especially
Yeah,
as
it
you get
was a
older.
lot.
I mean, my body, since I turned 40, it's like everything's falling apart. I give you guys kudos for doing that, and you guys even made it in the paper and for the Detroit Free Press, didn't you?
Yeah.
Crossing the finish line together.
Yeah.
Is that hard? Is that hard to run together? Because I mean, Adam's a little taller, different strides, different pace.
Well, I mean, we trained the whole thing together, so we kind of push each other. I think more at the end, he was probably pushing me. He could have definitely ran it faster without me. So that's always kind of the dilemma. Like, because now he'll run with Elise, and I think I'm getting slower, and then he runs with her, so that makes him a little bit faster. So I don't know if we could run again, but he said nope. That's the whole point, that we're supposed to do it together.
Yeah.
But yeah, the picture makes it seem like, oh yeah, we were like holding hands because we love each other so much. That's not what it was about.
Yeah.
It was about, we're holding hands because you're not getting a faster time than me. Like, we're gonna cross at the same time.
Yeah.
So there's some little competitiveness with stuff like that. So
Good.
yeah, we'll see. We haven't been doing a lot of running. And again, like you talked about things, aching, and, I've got some arthritis in my foot, and, just things. So I don't know if I'll do another one or not. But now the thing is, Elise wants to do a half marathon with us.
So maybe at least get one of
gotta
those.
do one more,
Yeah,
at
at least
least.
one more.
Yeah. But no, I'm not going to. I really don't think I'll ever do a full.
Yeah. I mean, it was pretty, like, just training. I know it was a lot, like
It is.
physical and time schedule. I mean,
Right.
I remember you guys getting up at like 5 o'clock in the morning and go for a run before you went to work. And
Yeah.
I'm like, oh my gosh.
And the weird part of me, though, like, I liked the schedule, though. So that's kind of that. Like, because if I don't have a schedule, it's very easy to say, I'm just going to turn my alarm off. Like I did yesterday when my alarm went off.
It's just like going to the gym or anything else. Once you get in that routine, that schedule, it's a lot easier.
Okay, we have to do this because if we're going to run a race, it's not like for us, and this isn't to say anybody else's goal, whatever your goal is your goal. But like when we do something like that, we want to do it and like have a certain time. It's, it's not just to finish. Like, we wanted to run it well for us. I mean, compared to like how Elise would run it, it would be slow. But so the schedule was good in that sense. But the one reason that we never did it this past year was because it just seemed like too much with going to all of the kids' stuff.
Yeah, you never get a break. Even to get away for vacation is hard.
Right.
Between you guys having both businesses and kids' activities,
Right.
There's only short windows.
Yeah. And that's the other thing about having a business is if I'm not there, there's no money being made in the business.
Yeah.
So, because I don't have anybody else that works for me as a doctor. So getting away is a little bit difficult.
Do you think that was a smart choice to purchase a business versus like starting from scratch?
Yeah. Oh, definitely.
Yeah.
Definitely. Because of the patient base. That automatically kind of stayed with us.
Yeah. Adam and I talked about it one time about business and startup, and he said the same thing. I'd rather start with a business that's already established and already has a clientele and
Right.
and just grow from that. And which he has. He's taken over the family business and kind of excelled in that. And
Yeah, I think it depends, on what, I read things all the time. I'm on different Facebook optometry forums, and that question kind of comes up. Is it worth buying this particular business with these kind of stats versus opening cold. So, it really just depends.
Probably location, what kind of clientele they have.
Yep. And some like retiring doctors, unfortunately, kind of run their businesses down into the ground. And there's not really much to purchase.
Right.
So that's my goal, is to not ever do that. I really don't think I want to go out strong. So I want to continue to bring in technology to stay up to date, not to let my equipment be, falling apart,
Yeah, no, I remember when you took over the business there on Main Street, everything came with the purchase, but a lot of it was dated. So you kind of improved the technology and the equipment. And then what things kind of, I'm sure some of that separates you from another doctor. Is there certain things that you're offering right now that is kind of cutting edge? I mean, at one time you guys are cutting your own lenses.
Right. Yeah. And we decided that just wasn't worth the headache. We could do it. And we did. It was financially advantageous, but, with staffing became an issue for a few years for me. It's been great the last few years. But that was just one of those things. You have to have somebody that's really well trained to do that. And I didn't want to do it on my off hours. So that was something that we gave up. But it's more important to me to be, doing the kind of things that are going to enhance the patient experience, and also to give me the best way of assessing eye health or treating eye health. So I would say the big things in our office are something called OCT, which is like an ultrasound of the eye, but uses light waves to separate out the layers of the retina. And so I can really assess and monitor macular conditions, like people have heard of macular degeneration. That's where I can really watch it. And, if something, to be able to determine what I can manage in my office versus what needs to be referred out. And glaucoma, the same thing, so that I can monitor and treat glaucoma. That's one of those things that really needs to be, you have to have that, I believe, nowadays in your office. And that's something that wasn't even, that wasn't being used when I was in college. This is since, but I've been out for 22 years now too. So
22
are there any
years.
new pieces of equipment that are being created or are out there now that you really want?
Well, so I have an awesome retinal camera that does central views of the retina. So again, macular degeneration, glaucoma. This is known to be one of the highest qualities cameras on the market. And I have that in the office. But it doesn't do really great full eye views, peripheral retinal views, especially with somebody who's not dilated, which patients really don't want to be dilated regularly.
Yeah, I was
right?
going to ask you, like, why
Right.
do I have to get my eyes dilated?
Right. So we want to see the peripheral retina. So we want to see early holes or tears in the retina, eye cancer I've caught on just routine dilation. Oh. So things like that. But it takes a lot of time from, our perspective even. It's not super convenient always, but it's also something that patients don't really like. So I would like to bring in, and I plan on doing this in the next few months, another type of camera. So it's a different technology, and it's going to get those peripheral retinal views for screening so that we can dilate less often in patients who aren't high risk. Mm-hmm. People like diabetics, they really still are going to need that annual dilation, or it would be recommended. But this is going to help offer that. And honestly, one of the other things is I just like that extra thing for me to say, okay, not only have I looked, if somebody has certain types of symptoms, flashes, floaters, things like that, I've looked, I have another double check. So it's not necessarily, I don't always make the best financial decisions, I would say. And I say that because we're not going to get paid anymore to bring this in, okay? Because we're already doing retinal pictures. It's the same thing. It's just a different way of doing it. But that's just the part of me that
just loves the benefits of great technology.
Yeah.
Like,
I
isn't
do.
it
I
great?
do.
And the best for your,
I
and the
love
best
it.
for your,
And the best.
for
Right.
everybody. Yeah.
Yeah. So that's, and I think that's kind of the thing about our practice. I mean, eye health is like one of the top things that we're really focused on. And along with just, I mean, my staff's like, it's creating a very friendly environment.
Oh, you got rock star staff. I was going to talk
yeah.
about them. I mean, they've been there quite a while. I mean,
Yeah, a few years now all of them have been there at least 3 years and some longer.
yeah. I mean, from the time you walk in, you get greeted to the time you make your little mini lap around to all the little stations and get fitted for eyes and come back and get fitted. I mean, it's a rock star operation you got.
Yeah, thank you. We love our patients.
It's
really.
a little gem in a tiny town.
It is a gem, yeah.
Well,
It's
thank
beautiful.
you.
Especially
It's
the interior,
modern
and I appreciate the opportunity to renovate your space. It's one of my favorite.
I'm so glad
Yeah.
that we did. I mean, I'm so thankful for all of it. I just can't.
Other than
get
it was
over.
a bank and it was built like a ball.
Yeah.
So
Yeah.
Literally.
it was.
No, it is honestly. I feel like this would have been my dream. Starting out. Like I said, 22 years, and I've had that office now it's 4 years now, but 3.5, I think, since we moved in. But yeah, I walk into the office every day and I love it. And I finally have just wonderful people to work with every day. I like seeing my staff. We like talking and chit-chatting.
We talk about that as like, you got to enjoy coming to work every day. It's not even, at some point, it's not at work. It's just, it's what you do. It's what you talk about technology and passion, and you're buying a piece of equipment that you're not even getting compensated back for because you're concerned about their eye health, and you're passionate about what you're doing and your clients that are coming in, your patients, and it's just amazing. So our community appreciates you for sure.
Thank you. Glad I'm here.
Definitely.
But before you leave, I got to talk about one thing. I'll tell you one thing I hate going to your office about is that stupid eye puffer. You go there, they're like, open wide. I'm like, bam, poof.
Yes. So
I don't need a poof in my life, I'm telling you.
yeah, there are other options.
Oh, jeez. I mean, I don't mind. I get through it, but it's just like,
Yeah.
you just like,
The
yeah.
anticipation.
When's it gonna go?
Yeah,
When's it gonna go?
I know.
Like, I need my
I
own
know.
button. Like, let me do it myself. It's just,
I probably should put that on my list of things to
Yeah.
replace too. It is, if you ever had one of the old air puffs,
Yeah.
like the original, that one, the one that we have, is a piece of cake. I mean, those were like crazy intense. These are way better, but yeah, there are some other like newer screening things that we could probably replace with. But
I mean, I don't even know what we're doing. It's like a test.
I'm like, it's so
you
fast
You gotta
and
see the
easy.
little dot, and they're like, I'm nervous. I don't want to blink because if I blink, they're gonna puff me with my eye closed, and I'm gonna have to do it again. So I'm like,
Okay.
I'm almost like pressing my
Is
eyes
the
open.
purpose to dry
I'll
it
let-
out? Are you drying
No,
out?
Oh.
no. It actually, the puff pushes against the cornea, which is the front of the eye, and it changes the shape. And then the machine reads how much it changed, and that tells how much pressure is inside. It's kind of cool the way it
Okay.
works.
Interesting. Okay,
I mean, that's
fine.
fine.
That's fine.
I just want my own trigger button. You know,
So
I
yeah,
mean, it's like,
I'll make sure that if I get a new one, I will call you right
yeah,
away and let you know.
We'll test it.
Yeah.
But I'm just asking to do my own puffer.
You want to hit it
You would,
yourself?
yeah.
you would never. You would sit there for 20 minutes.
I was like,
I
no,
don't
you
know.
do it. You do it. You go press the button. I can't do it. Well, Gene, I appreciate it. Thanks for coming in and getting gritty with us today.
Yeah.
And wish the best of luck. Appreciate everything you do for our community.
Thank you.
So thank you.
Thank you. Thanks for having me.